Hello, this is John Malone from Plymouth Medical. I just want to introduce you to the new patient breathing circuit for the Nitronox Plus. I'm going to review your old circuit and I'm going to review the differences and how to attach your new circuit. So we're used to the traditional coaxial circuit with the inner blue tube and the opaque white tube coming along. And remember that when we attach this plastic Y to the connection port on the far left of your machine, the pink component here, the exhalation limb, was pointing down through your basket. So the gas flow, and if you've ever heard me teach nitrous oxide, I teach that it's an invisible blue gas. It's not, it's a clear gas. But when the patient pulls on the demand valve, the invisible blue nitrous oxide goes through the inner blue tube all the way up to the elbow and either attached to your mask, your patient, or to your mouthpiece. If you use a mouthpiece, make sure that you put nose clips on your patient. Since a lot of people are nose breathers, I want them to inhale and exhale through this white covering tubing back to the T, so the exhaled nitrous oxide goes down towards the floor. All right, that's our coaxial circuit. We've now changed to a dual limb circuit, which is a traditional type of circuit. This is the way it comes packaged, a little bit smaller, now comes in boxes of 20 instead of 12 and everything. I'm going to show you an open one and explain the differences and everything. So basically, when you open it up, you're going to have a T, just like the T on this tubing, all right? But on this one, the plastic T attached to that port. On the new tubing, on the T is where either the mask or the mouthpiece will attach. All right. So now this T is what the patient will be holding. And this is where, again, the mouthpiece or the mask will attach. So if you understand how I explained the nitrous oxide is an invisible blue gas, the blue limb is the one that's going to attach to the far left connection port. And you'll notice that this tubing can expand. So you still have 6 feet of tubing. It's just expandable. The blue port goes on. The mask or mouthpiece goes on to the T that the patient holds. And the patient exhales through this pink tubing, which again can be expanded to about 6 feet. At the end, you're going to see a hard plastic port. Just feed that back down through your basket, the way we did with our other one. And basically, this is your circuit. Again, coming in boxes of 20, not 12. It's a few dollars cheaper for each circuit. And again, you can either use the mouthpiece. If you do, remember to use your nose clips. Most people are nose breathers. I need them to make that inspiratory effort to open the demand valve. But again, this is your new circuit. Very common for people to try and put this T here. It doesn't fit. Again, this is where the mask or mouthpiece will attach. The patient will then hold this, and your blue tube will attach to the port where the invisible blue nitrous oxide gas flows. If you have any questions, reach out to plymouthmedical.com, or you can reach me at john@plymouthmedical.com. And thank you very much. I hope this explains the new circuit.